Ehlers Danlos syndrome is a connective tissue disorder where all of the collagen in my body lacks an essential protein, which causes hyperelasticity of all of my connective tissue. So that would include everything from like my skin to joints to even the vascular connective tissue. A lot of complications happen with Ehlers Danlos syndrome because of the hypermobility aspect of it. You can injure yourself very easily. You also heal differently than other people. You may bruise much more easily. Your scars will heal differently than other people as well. Keloid scars are very common in Ehlers Danlos. The way that Ehlers Danlos affects connective tissue, you may also see pyogenic papules. I can't say it. Which I have. It's basically where fat tissue pushes through muscle fiber, the bottom of your feet, and through like the bone. It's very uncomfortable. I've been dealing with it for years. Gastric paresis affects the stomach. This is another condition that you can often see presenting with people that have connective tissue disorders. What is very frustrating though is that I got referred to the high-risk GI clinic for a number of reasons, and I already have about 12 specialists that I do see. And what I'm experiencing, trying to advocate for myself, is talking to doctors who are lazy, who don't take the time to look up certain things, and they're very dismissive, and that is very frustrating. One example is after dealing with symptoms of gastric paresis for about 3 years, I finally had my second gastric emptying test. And that's when I finally was diagnosed with the thing that I had been experiencing for years. And gastric paresis is a motility issue. It is neurological in nature. Basically, the motility of my stomach is very ineffective. And so when I eat, when I drink, it doesn't really matter what it is or isn't. I'm going to have difficulty digesting it. It's going to sit in my stomach longer than it should, which then subsequently causes other problems. I do also have diverticulosis, which is basically where the intestinal pockets, they kind of, well, you get pockets in your intestinal lining, and that is also because of like hyperelasticity can cause that, which is why you'll also see that coexisting with people that have connective tissue disorders. I also have dysphagia, paralingual phase, so I do, and I've had difficulty swallowing for a while. Now the issue is that having Lyme in 2015 and then having thyroid cancer in 2016 and having my thyroid removed and one surgery in April of 2016 and then having the other half taken out in June of 2016, and then having a subsequent surgery 3 years later, having 37 lymph nodes removed from behind my jugular. My vagus nerve, my cranial nerves have been manipulated quite a bit. And then, I have bilateral neuropathy. I have Chiari malformation. My brainstem descends into my spinal column about 7 millimeters, which doesn't sound significant, but because the brain is so sensitive, I do have symptoms that my specialists do suspect could be linked to the Chiari, as well as chronic migraines. And then finding this year that I've also been autistic my entire life, and then just kind of feeling like why that, like, it shouldn't have been a shocker, but it was. So I've been dealing with a lot, and then with gastric paresis being a motility issue, I did start working with a dietitian, and part of what I'm dealing with is accepting the fact that, like, when I eat, I really can't eat more than 2 ounces at a time, which makes it very challenging. You know, I'm going from doing like multi-grain bread and chicken and like lettuce and tomatoes and all these things to going back to wheat flour and just grilled chicken in small portions and like mostly liquid food. It's kind of depressing. The list of like recommended versus not recommended foods is like stressful. You know, gastric paresis has been linked to Lyme, neurological dysfunction, thyroid dysfunction, and connective tissue disorders like EDS. So I guess it really was just a matter of time. Like, I'm just kind of like grieving a lot right now. I did get like a mild form of Bell's palsy following the COVID vaccine that I was forced to get when I was inpatient in June of 2021. And that has resulted in my right side being weaker than my left, more so than it was before. But since I was already having deficiencies, I didn't really feel like validated to do anything about it. And I also know that the COVID vaccine manufacturers have like freed themselves from any liability. And I've also continued to get the vaccine 2 more times since then, because when I did get COVID in July of 2022, I do feel like my experience with it was rather mild. I mean, it was very strong, but short-lived. And I was able to get on Paxlovid, and that helped. But yeah, so someone asked me why I've been crying a lot lately, and I just am having to come to terms with a lot of things after already having had to come to terms with a lot of things, and it's just freaking hard sometimes. And I had already tried to change my diet when I noticed that I was having a lot of really bad GI symptoms, and just dealing with the fact that like at one point in my life I was like very, very active, and I still push myself to be, but I deal with chronic pain. I am diagnosed with fibromyalgia. I live in a state of pain. You know, when you go to the doctor and they're always like, hey, so how's your pain today? Does anything hurt? My good days are 5, and I never have a day below 4. And it's just exhausting, and it's frustrating because I don't want to be limited. I don't want limitations. And you know, I used to be somebody that could like run miles and miles, and it felt so good. Positive sides. I had reconstructive jaw surgery September 2023, and I actually have a closed bite for the first time in decades, and I'm able to properly chew my food. And I can breathe with my mouth closed now for the first time. Part of why the gastric paresis diagnosis is so difficult is because I also know what I've been through in my life, and I'm noticing a link between GI dysfunction and trauma. And I was severely abused when I was a baby, and I want to talk about this stuff because I think it's important. People talk about how children are resilient. I believe it's more or less just the human spirit is resilient, but people are people, and abuse has lasting effects. My birth mom would lock me in a bathroom so she could go get high, and would leave me in dirty diapers. And now being a 37-year-old woman, being diagnosed with pelvic floor dysfunction, dysregenic defecation, and gastric paresis, and seeing like this neurological link to the mapping that my body did in infancy, learning to have dysregenic defecation related to trauma. You know, when I went to go live with my parents that raised me, I still have vivid memories of being forced to sit on the toilet while drinking cranberry juice or prune juice because I just wasn't having bowel movements. And people say, like, your kid's not gonna remember, just do better, or you know, if the child is injured or the child has trauma, it's okay because they won't remember it as much, or it's not going to really affect them later. But that's a lie. It's a lie that removes responsibility from adults to support other adults and other children. My birth mom was in the middle of an acid trip when she was 4 months pregnant with me and realized that she hadn't had her period for a few months. I was told that story when I was 17 by my birth mom after not seeing her for 12 years. I want to talk about these things because I believe just through my own experience that we internalize emotional trauma physically, and gut health is a link to the dysfunction in gut health can be linked to childhood trauma as well. I think that there's a physiological response, and I think it's important that we talk about our experiences in order to heal. And also for awareness and visibility. Having chronic illnesses can be very depressing over time, and feeling powerless and unseen and misunderstood is exhausting. And so I spent a lot of my life retreating from people in my own family, and I didn't communicate a lot when I was going through scary things. The amount of anxiety I would feel over communicating was very intense, so I would just avoid it, and that got me into a lot of dangerous situations. Gosh. I'm going to be sharing more in-depth things. It's very challenging to have to constantly think about what you're eating and when and how much and what you're going to have to pay for later. I get extremely bloated after anything I eat. And you know, you don't really realize how many social things are linked to enjoying food, enjoying coffee, enjoying things. Being reminded of so many things just by the simple, ask of, hey, let's meet for food. And then not wanting to offend anybody, but then also maybe over explaining why you can or can't eat certain things or amounts. I'm just trying to avoid being on a feeding tube. I just wanted to talk about it.